Yeah, so there's still some unmet needs despite the great progress that we have made, and it's actually really exciting progress that we've made for our patients that the scientific community has. It's really been a big win in terms of the scientific community in general. But still some unmet needs. The big one, of course, is disability progression. So there's still some patients who continue to get worse despite optimal therapy, despite the fact that they're not having new MRI lesions, they're not accruing any relapses or experiencing any relapses. They're still accruing more disability over time, and that's a huge unmet need. There still needs to be a lot of work in that arena. Some of the causes of that disability progression have been identified, or we think they have been identified, and so we've already jumped into trying to treat that, and that's where BTK is one of those promising types of drugs where potentially we can affect different ways of affecting disability progression more directly. But there still remains to be a lot that's to be discovered there. And I think that probably is only a small piece of the puzzle overall. So that's one thing that still needs to be worked on. The other is repair, right? So a lot of patients have disability already, or they have a lot of symptoms already. And right now, at best, all we can do is try to manage their symptoms and accommodate their symptoms. We can't really fix the symptoms, and that's really the holy grail of reparative, restorative therapies. I think it's still several years away, but that's really the hope of a lot of stem cell work and things like that. Yeah, currently the best practice is either to use pharmacological approaches, so medications that may help fatigue a little bit. There aren't really great drugs that help cognition, although some people do try certain medications that may boost cognition a little bit. For things like neurogenic bladder, there are some medications and other approaches that may be helpful as well. And then really looking at other modalities as well, beyond pharmacological approaches. So these are things like psychiatric or psychological approaches to things, alternative medication, what we call integrative medication now, integrative health. So those are also other approaches that we're doing right now. So in the space of unmet need, a lot of things are trying to fill that need, but I think it's still not quite adequate. Yeah, I think there's a lot of exciting data when it comes to disability progression and the promise of treating it. Obviously, that has to be proven out in the phase 3 trials, but a lot of analysis of the phase 2 data is really promising, having signals that suggest that we might be successful. And that's always good when you're in phase 2. If there wasn't any of those signals, I'd be very, very pessimistic about the phase 3 data, but right now I'm actually pretty hopeful that we'll see at least some benefit, additional benefit over our current disease-modifying therapies. So I think that's very exciting, and that should make a big impact in our patients' lives